I mean, carbohydrates are not the enemies, first of all. And they are most necessary for your day-to-day activities. If there are no carbs, how will you function? Complex carbohydrates have low GI index and very high fibers. Carbohydrates are present in all the fruits with skins, all the legumes, all the grains. There is a rule, like a rule of a plate. If I have a plate, I need to eat it, right? Half of the plate should be these complex carbohydrates or vegetables.
Achha.
1/4 should be the proteins. Proteins are very necessary for everything, wear and tear of the body, and 1/4 of the portion should go with your whole grains. Regarding shift of the gehu atta versus jawar, bajra, millets, or your nachni, all these have got lower GI index, and they are more filled with micronutrients. This guava, papaya, apple, berries, muskmelon, watermelon. And then low GI index fruits are like kiwis and dragon fruits. These are good to go, can eat fully with skin. I generally do not recommend any juices or any smoothies like banana, then mangoes, then grapes, chiku, jackfruit, which is amply available in these seasons.
Yes.
So moderation is key to success. So you can have smaller portions. You can use them as treats.
Is your diet quietly healing you or silently raising your sugar levels? With so many trending plans, food myths, how can you be sure what truly works for diabetes? Can diabetics enjoy fruits? Is intermittent fasting safe? Should carbs be completely avoided? In today's episode, we decode the science behind diabetic diets, separating facts from fad. Joining us today is Dr. Vaishali Pathak, a leading diabetologist with an MD in medicine, known for her holistic and personalized approach to diabetes care, with deep expertise in managing diabetes and its complication. She empowers patients not just with prescriptions, but with knowledge and lifestyle tools to take control of their health. From prevention to long term management, Dr. Pathak blends science, empathy, and strategy to help people live healthier, fuller lives despite the diagnosis. Let's dive into this world of smart, sustainable diabetes care with one of the best in the field. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Vaishali Pathak. Hello, ma'am.
हेलो, हाय तुषिता.
कैसे हो मैम?
मैं बहुत अच्छी हूँ. आप कैसे हो?
हमें तो बड़ा मजा आ रहा है. I mean, the topic which we have selected today is something that I really wanted to, know all about it. But then I want to ask you, how does it feel to come here?
Oh, it's great. Great to see you here. You're always very bubbly. So
thank you.
I like your energy levels.
No. Okay, so ma'am, you have been seeing these diabetes patients day in day out in your OPDs, and you have been treating them for so long. I'm pretty sure कि the most common questions which comes from a diabetic patient is ये खा सकते हैं क्या, वो खा सकते हैं क्या, and so on. So
Yes.
that's why we chose, we thought that let's have an elaborate session only on diet and diabetes. So be it carb or, fruits. So we'll talk about all that.
Yes.
So how does it work? Like the role of carbohydrates and, in diabetic diet. Is it only portion controlled or should it be completely avoided? How does it work?
I mean, carbohydrates are not the enemies, first
Achha.
of all. And they are most necessary for your day-to-day activities. If there are no carbs, how will you function? No way. So there are two types of carbohydrates. There are simple carbs and there are complex carbs. So the
Okay.
simple carbs are like present in all glucose and all the sugary drinks, and you add sugar, your desserts, everything, and in some fruits as well. But complex carbohydrates are, yes, way to go. They are full of high fibers, and their glycemic index is low. What is glycemic index? I mean, when you consume something, the amount of blood sugar level which goes up, that is, we call it as glycemic index.
So basically release in the blood.
Release in the blood. So complex carbohydrates have low GI index and very high fibers. So they are very good in terms of all diabetic patients. They are satiety feeling, and they have good amount of fiber. So their gastric emptying is on lower side, so you feel kind of full at all the times. And
Okay.
uh, these carbohydrates are present in all the fruits with skins, all the legumes, all the grains. So these are complex carbohydrates. We are good to go in all kinds of diets.
Okay.
Now the
So
portion control, as you rightly said,
yeah,
yes, anything in moderation is key,
is key.
right?
Correct.
So whatever you are eating has to be a portion control or
Monitored
monitored. And there is a rule, like a rule of a plate. If I have a plate, which is I need to eat it, right?
Mhm.
So I would recommend that half of the plate should be these complex carbohydrates or vegetables.
Acha.
1/4 should be the proteins. Proteins
Acha.
are very necessary for everything wear and tear of the body. And
Mhm.
1/4 of the portion should go with your whole grains. So
Acha.
that is the way, the plate should be full.
Mhm.
So in that plate, if you consume good amount of complex carbohydrates, your stomach gets full, and then the proteins, then you don't feel those cravings to have more carbohydrates and to get that satiety. So portion control is key. What you eat is definitely very important aspect to complete your meal also.
So, ma'am, this when we talk about simple carbohydrates and complex carbohydrates, so we understood that the simple carbohydrates are usually present in the drinks or some basic fruits which we eat. But then this rice and wheat, which category do they come in? Are they simple
No,
carbohydrates?
they
Or?
are, see, rice and wheat, they are complex carbohydrates because they have see, simple sugars are something which is easy to metabolize. And these are like, most of the time added sugars.
Acha.
The complex carbohydrates are present in all these, as I told you,
Mhm.
that they're present in fruits and vegetables, and then, your whole grains and legumes. So rice and wheat have got complex carbohydrates. But some rice has got high GI index, wheat has
Acha.
got high GI index, but at the same time, the millets have got low GI index.
Acha. So, is there any? I mean, why I'm asking you this question is because I have some family members of mine who are diabetic, and the commonest thing that I've heard them saying is कि चावल मत खाओ, shift to roti. So my point here is roti really good, better than चावल, or should चावल be completely avoided?
राइस है ना, पूरा
हाँ.
वो एनिमी बन गया है.
हाँ.
In the world of diabetes, in the world
Yeah.
of this metabolic diseases,
Yeah,
it's
weight
not
management
it's not
everywhere.
it's not that bad because it has got a high GI index. But when you combine, see, you can eat the other types of rice, something like a parboiled rice, something like a brown rice. Brown rice has got like very high fiber index
Fiber
because
index.
उसका बाहर का cover वैसे ही रहता है.
रहता है.
So that's the reason it is.
So you recommend brown rice?
Yeah, we do recommend brown rice when somebody wants to eat the rice. Now, if you combine rice, because it's carb, with good amount of proteins and fats, you add paneer, you add chicken, you add fish, you add soya
Salads,
chunks,
sprouts, and all.
you add all legumes, and make it and add good fats, then it becomes a whole good meal with some carbs, good proteins, and some good fats.
So, do you recommend that people who are, on atta, gehu, should they shift to jawar or bajra?
Yeah, see, again, the glycemic index.
Yes.
The whole game about diabetes is about glycemic index, glycemic load, and all those things. I mean, the whole game plays around.
Correct, correct.
And the food industry is revolving around.
Yes.
So, regarding shift of the gehu atta versus jawar, bajra, millets, or your nachni, all these have got lower GI index, and they are more filled with micronutrients. Like, they will have more magnesium, they'll have more iron, more calcium, more B complex variations, which the wheat is lacking. And wheat has got lesser fibers, wheat has got more GI index. So we definitely prefer jawar, bajra over wheat or rice or other carbs.
So it's basically what we are trying to understand here is if you need to if you're really serious about, and which you should be, about the managing your diabetes on a long run, it's always advisable to shift to these alternative options.
Yes.
Rather than going with the mainstream, which is atta and chawal. So that's about the carb part of it. Now, when it comes to the fruits, some of the common fruits which are again the villain, I don't know, whether they're truly villain or not, like banana, mangoes, and certain fruits, other fruits also. Like there's a common myth that, if you're diabetic, do not eat much fruits, and it's not very good for your sugar levels and glycemic index. So is it true? I mean, are fruits? Are some fruits
No,
are really bad?
no, not really. See, we recommend to eat seasonal fruits
Hmm.
because they have other qualities like, full of vitamin A's and citrus
Yeah,
fruits and all
yeah,
those,
yeah.
multivitamins and all those things
Mhm.
are ample in them.
Mhm.
So there are some fruits which are safe fruits, and there are some fruits which are little unsafe fruits. So
Okay.
I would divide them like, this guava, papaya, apple, berries, muskmelon, watermelon, and then low GI, again low GI index fruits are like kiwis and dragon fruits. These are good to go, can eat fully with skin. I generally do not recommend any juices or any smoothies because you kind of
Yeah.
lose all the fibers
Yeah,
into
you
them.
extract all the,
Extract,
it's just
exactly, exactly.
sugar rush.
Yes,
Yeah.
no, so it's a big no to them.
Yes.
But regarding the unsafe fruits, but they're like, I still won't call them unsafe fruits.
Yeah.
It's like the fruits with high GI indexes like banana,
Mm-hmm.
then mangoes, then grapes,
Mm-hmm.
chiku, jackfruit, which is like, amply available in these
Available,
seasons. So
yes.
moderation is key to success. So
Mm-hmm.
you can have smaller portions, you can use them as treats.
Mm-hmm.
So I would not
So,
recommend them to
so
skip at all.
would it be right that, suppose if somebody really likes
Mango.
mango, yeah, so maybe add it up as a
Yes,
fruit salad, as a portion of it,
yeah,
then don't eat
then
the
yeah.
whole thing.
No, don't eat the whole thing.
Ah,
And if you want to add it up with maybe a Greek yogurt, or banana can be added with a peanut butter and
acha,
can make a good thing out of it. You
combination
can
out
make
of it.
add some nuts to the fruit bowl
True, true,
and
true.
eat it. So you'll have a good portion of fruit, as well as you can enjoy the fruit, and you can have
Yes.
the nuts and you'll have the proteins also.
Proteins also. So while we talk about the portion control, which is, a must for a diabetic patient, what's this concept around 8 meals a day? Is it actually helpful? I mean, would you recommend somebody?
I mean, I ask you one question.
Huh.
Is it possible for you to eat 8 meals
I
when you're
don't
working the
know.
whole day?
No, I mean,
No,
it's difficult for me to even eat
I
three
mean,
meals.
it is easy to say than
Huh.
done,
Yeah.
right? So it is very bookish, I must say.
Yeah.
Even I tried some time back to, switch it my meals to eight meals a
But
day.
नहीं हो
To
पाता
taking
है.
nahi ho pata hai.
नहीं हो
It is
पाता.
not easy. See what amount of calories you require or I require. Say my requirement of the calories is 1500 calories with XYZ macros. I mean proteins, fats, and carbohydrates.
Hmm.
What I consume in a day is more important than how many times I divide those calories.
Hmm.
So there are fat diets like 1 meal a day these days,
Yeah.
huh? Or 2 meals a day, or say intermittent fasting.
Yes.
So the matter is that how many calories do I finish in those 2 meals,
Mhm.
4 meals, 5 meals, or 8 meals. But if I am eating above those calories,
Mhm.
then definitely I'm going to increase, that is going to increase my weight, increase my blood sugar levels.
Mhm.
So calories and macros are more important, not how many times a day you eat.
Okay. So, ma'am, as you spoke, right, that there are many concepts which are coming up right now, which is intermittent fasting, then something also called as a keto diet,
Hmm.
right? So, do you recommend, or is it okay for a diabetic to do an intermittent fasting or a keto diet?
See, these are the fad diets. The concept which came in some years ago was about the intermittent fasting, was that eat 2 meal a day, and then in between 2 meals, 55 minutes time frame, you can eat anything. I have seen my patients eating pizzas to farsan to gulab
Oh my
jam in
God.
1 meal because they were told that way.
Uh,
See, again, the what is important is calorie restriction.
Calorie restriction.
Calorie restriction is the
Mm.
only key to
Mm.
manage your sugars, manage your weight.
Mhm.
So intermittent fasting I will not recommend, because there was a study done which recommended some patients were put on intermittent fasting,
Mhm.
and when the study results came out, it was said that the results said that there were more chances of heart attacks after the intermittent
Oh
fasting,
my God.
and muscle loss was much more with intermittent fasting than
Uh-huh.
routine fasting. Now comes
Uh-huh.
the keto diet. Keto diet is what? A zero carb diet. It is full of
Yeah.
proteins and fats,
Yeah.
and these kind of diet need lot of studies prior to starting that
Starting
your
it.
cholesterol should be normal and you should not have migraine. So my recommendations to my patients is that do not follow these fad diets. Follow something which you can follow lifelong.
So which
Do
we
not
shouldn't
do, yeah,
sustain.
it's a
Yeah.
sustainable diet. You cannot do something which is there just for a month and then, you feel very nice doing some fad diet and you kind of lose some weight, lose some, reduce some sugars and then
Go
leave
back
it
to
and go
that.
back to
Go
your
back to the old.
routine and then gain your weight,
Yeah.
gain your sugars. So might as well you stick to your diet, you stick to whatever you have been brought up eating and manage your carbohydrates, manage your proteins into that.
So, when we talk about meals, and also there has been a lot of talk happening about glucose, continuous glucose monitoring, like how you can, keep a close check on your sugar levels and all that stuff. So, meal timing, does it also play an important role in managing this, or is it only portion size?
Meal
Are we talking?
timing definitely matters because your hormone regulation works around that. So meal timings and some discipline to the life is definitely important. You can't have today 2 o'clock meal, then the younger generation is having meals at 2 a.m. At night, then they will go back to your whole hormonal cycle changes, your whole cortisol comes up, your all the enzymes come up, and then you get fat, your insulin resistance comes up. So this is not recommended. So
Okay.
meal timings are necessary. Discipline to life is definitely very necessary.
Now that diabetes has become also it's no longer, a senior citizen or a geriatric population problem. It is very frequently seen in young adults also. So while these young adults are mostly the working professionals that who are, busy working in their schedules, do you have some tips for them? How do they manage? Because I'll tell you personally why I'm asking you this. I'm not diabetic, but on those days where I have too much of work pressure, I end up skipping my lunch. Many of the days, my breakfast just limits to
So bad.
chai. So I should just hide my face probably when I say this. But then, I just have a cup of coffee and then I'm running on coffee the entire day. But for diabetic patients, it would be a hazardous thing to do. So what one tip do you have? I mean, some go-to snacking or something like that. What one tip do you have for them?
Go to snacking, we can have lots of the first thing I think for the working professional, as you initially said, I would recommend plan your day, plan your meal, carry home cooked food. That's the best thing to do. Then in between snacking, yes, you can carry roasted nuts, you can carry makhanas, you can carry nuts like almonds and walnuts in your pocket. You can carry some small paneer salad or some tofu salad, or you can just carry the Greek yogurt, which is natural, which has got like 15-20 grams of protein and no added sugars. So these are good to go. Sometimes even the thirst mimics like hunger. So at that point of time, having a glass of water also gives you satiety, and it will eliminate your hunger for that moment. So keep yourself hydrated. So these things are good to go. And one more thing I would like to tell the professionals, because when I have talked to n number of patients who are like IT professional, working professionals, their pantries are full of junks. I mean, the cookies, the namkeens, the farsans, the vada pav, and whatnot. So I would recommend avoid going to the pantries. If you go to the pantries, carry your own meal, or carry your nuts and all those things and eat there. Regarding even tea and sugar, a lot of people say that I have got a habit of drinking 8 cups of tea in a day. So I don't mind having 8 cups of tea, but you can have those black tea, black coffee without sugar. Doesn't matter. But they take coffee and tea with sugar, and then there adds the problem. I mean, and then they're sitting all the time. So I just tell them, do not use the lift. Just stroll around every half an hour. Make some movements. Yeah. There's a rule of 30. I mean, every 30 minutes, just take one stroll and come back and sit on your table.
Yeah. So when it comes to the fat consumption, I mean, fat and the role of, the sugar release, which type of fat are good? I mean, are fats really good?
Yes, we do definitely need good fats. We do need good fat. There are good fats and there are bad fats.
Yeah.
So good fats are like, avocados, your almond oil.
But then isn't avocado very high in calories?
It has got a good fiber. It is, but body requires everything, right? Body
Correct.
requires fats. Body requires proteins. Body requires carbohydrate. Nothing is like this I don't need. So, your fish has got good fats. Your almond oil, avocado oil, then
So
fish.
which
Then
oil do you recommend for cooking?
The newer studies definitely say that seeds oils are big no, because these seeds oils are what, like groundnut oil or sunflower oil, safflower oil. These oils have got high inflammation. They increase your LDL, and they increase a chronic inflammation into the body, which leads to insulin resistance and leading to
Mm-hmm.
type 2 diabetes.
Correct.
So, which oils are good to go? They are monounsaturated fatty oils. There are
Okay.
monounsaturated fatty oils, and there are polyunsaturated
Break it
fatty
down
oils.
for us, please. Which
So
one are these?
monounsaturated fatty oils are present in almond oil, avocado oil, then olive oil, then your mustard oil. So these oils are good to use in your cooking, in your salad dressing, everything. But again, in moderation, because you can't use oil अच्छा है तो मैं बहुत use कर लूँ, ऐसा नहीं है. The other oils, the seed oils, as I said, there's a big no coming up these days. Lots of studies have been proven saying that seed oils increase the inflammation. Now, big no or red flag for the vanaspati, dalda, all these things, and
I think
ghee, butter.
I mean, in Indian household these days, the use of vanaspati and dalda has reduced.
Almost. I have not
reduced.
seen any supermarket, any vanaspati or dalda.
Yeah, earlier I remember there used to be proper advertisements
Yes.
about the vanaspati and daldas, but now I think those are also stopped. But yeah, as you said that seed oils should be avoided.
Yes.
I think there's also one concept of that you keep changing the oil which you consume.
Not really.
Not really.
Not
So
really.
is it okay to continue if I'm cooking in olive oil? Suppose.
Yes, why not?
So
why
I can continue that.
Very much.
Okay.
Very much.
What is this fad about this ghee and oil?
Ghee and oil.
Yeah, I mean ghee is better than oil. Oil hata do, ghee use kar lo.
It's not that. Actually, ghee has also got polyunsaturated fatty oils, so it's not highly recommended. Some portion of ghee is okay, but overall, the recommendations are, to use 500 ml per person per month. These are national cholesterol guidelines. So whether you're using ghee or oil, it doesn't make any difference. But per person per month should be not more than 500 ml. So as I told you, the oils which I mentioned are good to go. Ghee in a very small quantity, yes, can be
Is
used.
okay.
Is okay.
So with this fast pacing lifestyle which we have, though we try a lot to avoid packaged foods, but there's certain extent on which almost all of us consume some
Yes,
level of
we do.
packaged food. So this for diabetic people specifically, what are the few things which they should definitely look out in the label section of a packaged food item?
I mean, as you rightly said, the packaged food is anything and everything which comes in a package with the label is red flag, is no. But at certain point times when we are not left with anything,
Any other
choice but to eat them, kindly look for the contents. I mean,
so कौन से ऐसे हैं
तो फाइबर्स देखो, प्रोटीन्स देखो, आप उसमें एडेड शुगर्स कितने हैं वो देखो, फैट्स कितने एडेड है वो देखो, सॉल्ट कितना एडेड है वो देखो, एंड गो फॉर हाई प्रोटीन, minimally added sugars and high fiber.
So when you say minimally added, can you give us any ballpark number?
No, not really. I mean,
it depends
anything,
upon
it
the
depends.
entire
I mean, entire package
also.
and how many calories does that
तो वो
package
अगर
have?
1 किलो का पैकेट है तो उसमें sugar content किस level?
But minimally added sugars should be good to go. But if you are not left with choice, you have to see the contents of the package.
Okay. So we'll talk about the craving part right now, okay? Because I believe that craving is something which almost everybody has at certain point of time. So when it comes to the craving, like mid snacking or midnight snacking or something like that. So what are the good, munching options do you have for diabetic people?
Craving can be two types.
Achha.
एक स्वीट क्रेविंग होता है और
हाँ।
एक सॉल्टी क्रेविंग होता है. तो
हाँ।
सॉल्ट वाले को मीठा देके और मीठे वाले को सॉल्ट
वो
देके
तो नहीं
फायदा
कर
नहीं है.
सकते.
So first and foremost, the
Hmm.
cravings can be reduced first thing
Mhm.
by eating good amount of proteins and good amount of fibers in the diet. So the cravings will reduce.
अच्छा.
More carbohydrates you will eat, more will be the cravings.
अच्छा. Okay.
So if you manage that way, the cravings will reduce.
अच्छा.
If you sleep on time, midnight cravings will be
Snacking
reduced.
will reduce.
Snagging will reduce. Now, if you still have the snack, I mean
Mhm.
cravings, you can, if sweets craving is there, you can go for like dark chocolate, a piece
Mhm.
of dark chocolate,
Hmm.
or maybe a couple of dates,
Hmm.
or these high GI index fruit like a piece of banana or small portion of mango.
मखाना.
And in salty में हम मखाना,
मखाना
roasted
and all.
nuts ये सब खा सकते हैं.
खा सकते
You
हैं.
can add these fruits to the Greek yogurt and eat it like a fruit salad.
Mhm.
So you'll have good feeling that I had my craving, which is like done with on the sweeter side.
On the sweeter side.
Yeah.
So, ma'am, when it comes to the the Indian culture and the festivities which it brings in, it becomes a very difficult task for a diabetic person to, especially the time during Diwali, which is coming up
True.
in another
Mm.
couple of few months.
Mm.
So it becomes really a big task for diabetics to manage during those times. So the most common thing which comes up is कि घर पे बना लो, then this is okay because you have kind of control, or sugar मत डालो, sugar substitutes डाल दो. So my first question to you is कि are sugar substitutes really safe and should somebody switch to sugar substitute? दूसरा, अगर घर पे मिठाई बनी है तो is it okay to consume, because बाहर में we there are a lot of things which are on question. First is कि कौन सा तेल यूज हुआ है, कौन सा घी यूज हुआ है, घी तो छोड़ ही दो आप, शुगर कितना यूज हुआ है, and there are a lot of other factors. So help us take it, crack this.
I mean, sugar substitutes are okay to go because a lot of studies have been proven with sugar substitutes. So they are found to be safe and they're no more like, carcinogenic. So
Achha.
sugar substitutes, yes, can be used. But I would still recommend you shift to sugar substitutes till the time your palate gets used to,
The no sugar or low
no
sugar.
low sugar taste वाला वो जो feeling
Hmm.
होता है, वहां तक पहुंचने के लिए you can definitely use sugar substitutes. And then you can switch on to no sugar substitutes also. अगर घर में मिठाई बन भी रही है, and if you're adding sugar substitutes like sugar free या stevia कुछ आप डालते हो, but the fat content remains the same. But again the moderation, you can have a small piece of it. जिस दिन आपको क्या कहते हैं कुछ मीठा खाना है, you can work out little more. I recommend my patients you work out little more and can eat थोड़ा बहुत burn कर लो extra और फिर थोड़ा सा मीठा खा लो.
But yeah, that's also occasional.
That's also occasional. I believe in one thing like a calorie banking. Calorie banking में क्या होता है कि अगर मुझे शाम को कुछ मिठाई खानी है या पार्टी है, कुछ मुझे खाना है, so what I generally tell my patients that आप सुबह you eat more fibers, more proteins,
more salads and all that
more
stuff.
salads, and conserve those calories in the mornings का शाम के लिए. And then in the शाम को when it's a party time, then you can indulge into whatever you like. I mean,
but then again keep it in mind.
Keep it in mind, and then again it has to be portion control. It can't be indulgence like मैंने पूरा पेट भर के खा लिया, कुछ ज्यादा ही खा लिया, so पूरे हफ्ते भर का कैलोरीज एक ही मील में मैंने खा लिया, so don't do that.
So when it comes to diabetes and diabetic diet, because diabetes is also many diabetes patients will also eventually develop kidney issues, so like CKD, which brings its own diet restrictions.
Yes.
Right. So how do such patients, I mean, what tips do you have for such patients who are diabetic at the same time have CKD issues or other dietary restrictions? How do they cope?
So many patients you will see with other comorbidities like blood pressure है, और कितने तो patients को बाद में renal problems हो जाते हैं. Now in renal issues, yes, we definitely need to modify the diet, like in protein content कम होना चाहिए. So normally we recommend normal person को it has to be 1 gram per kg per day body weight. In renal patients we reduce it to 0.6 to 0.8 gram per kg per day. So हम proteins कम कर देंगे. We will reduce the potassium containing fruits like coconut water, bananas. Then we will reduce all the other fruits, because they are rich in potassium.
Rich in potassium.
Tea, coffee will have little more potassium, so we'll try to reduce the amount of tea and coffee. Now third thing is high phosphorus containing fruits like these legumes and
So एक तो potassium हो गया,
spinach,
next is
baby corn.
phosphorus.
हाँ,
Okay.
baby corn, spinach, legumes, उसको भी हम reduce करेंगे. Now, fluid restriction is another thing
very
to major
element,
element.
yes.
So we'll ask them to reduce the fluids also. So these are the things we need to, along with the reducing carbohydrates, we need to cut down on these aspects also.
Now, moving to the next aspect of, when it comes to diabetic diet, and it goes hands in gloves, is the exercise regime. So, when it comes to exercising, most common understanding is that do some form of workout, and workout के नाम पे जो सबसे पहले याद आता है कि जाओ जाके ट्रेडमिल में दौड़ो, which is cardio, या फिर कुछ, the first thing that comes is any form of cardio exercises. But what is the role of strength training, and how important is cardio exercises?
See, exercise is as important as diet, but diet is more important. I mean, diet will play 70% of the role in managing sugars, but the 30%, yes, by the exercise. Exercise is must. Now, we say that muscle is a main organ. So how do you build your muscle? It's only by strength training. When you do the strength training, then only your muscle fibers will increase, your sarcopenia, will reduce. When you you lift weights, your muscle grows. When you grow each and every muscle fiber, your insulin receptors will increase, and that will increase your insulin sensitivity, and that will reduce your type 2 diabetes. That will so
it's basically all connected
to each other. Now, strength training definitely plays much more vital role, as in it will reduce your HbA1c. It will give you good bulk and good strength to your overall skeleton. And
so
your
you just don't lose
basal
weight.
metabolic rate, which will remain high throughout the day. I mean, जो कैलोरी कंजम्पशन हम कुछ नहीं करते हुए रहता है, जिसको हम मेटाबॉलिक रेट बोलते हैं, बेसल मेटाबॉलिक रेट, दैट विल रिमेन हाई व्हेन यू डू strength training. But when you do cardio, the one thing, उतने 45 मिनट या 30 मिनट्स के लिए आपका बेसल मेटाबॉलिक रेट हाई रहेगा, and you will not have a good muscle mass. And moreover, in old diabetic patients, there is always a risk of losing your muscle mass, as well you're injuring your knees. So uske liye I generally recommend you go for strength training and build your muscle mass, and in between you do the cardio for the endurance. But cardio should not be the main exercise to keep your...
So you just can't do cardio and expect that things will be fine.
No, not at all.
So resistance training या फिर जो muscle training की जो हमने बात करी है, strength training की जो हमने बात करी, what precautions should are there any precautions that these diabetic patients should be taking?
Of course. Yeah. I mean, see, all the diabetic patients has to consult a diabetologist before joining any gym or any personal trainer.
Achha.
Why? Because they may have some cardiac issues or retinopathies. So, as we all know, diabetic retinopathies are very common with long-standing diabetes and any cardiac disabilities. So, उसमें अगर आप ज़्यादा weight lift करोगे, so it will be more hazardous to your heart as well as to your eyesight. So, पहले उसको check करो, then only start with the exercises. And when you start exercises, check your sugars pre-workout and post-workout. Because आप जब workout करोगे, as I told you, your insulin sensitivity will increase, and so your sugars will drop down. There are chances of hypoglycemia. The sugars will drop down. At that point of time, you need to adjust the doses of your insulin or your tablets with your diabetologist. Otherwise, you will have that episode of hypoglycemia, which can be very, very dangerous.
Yeah,
you can fall down.
It will be in gym, and you
never know what will happen.
So when it comes to strength training, so how should someone start with it?
Even someone can start at home, like doing push-ups, doing pull-ups, doing squats,
so these
doing
are
lunges.
Basically where you are using your own body. So the chances of hazards are
lesser. And you can start it at home. You need not go to some fancy gym to start the workout also. You can do Surya Namaskars at home. We have so many good, yoga exercises. You can do push-ups, pull-ups, planks, these are good exercises to go with. You can bring in small weights at home and start with that. I mean, jisko karna hai uske liye everything is, where there is a will, there is a way.
Very true. So I'm moving on to the next segment, which is the rapid fire questions. So I have some basic questions. I think most of it we have already covered in this discussion, but just a brush up again once on those. Rapid fire. First question is brown bread. Is it really healthy or just a fad?
At least in India, I would say it's a brown colored white bread. So not so it's a maida bread with a brown color.
Oh my God! So how do we choose the right one? So wheat
So
bread?
no, I would say you can go for multigrain bread.
Acha.
They are better to go than any other these breads, because maidas are no.
Okay. Okay. So maida is no. Okay. Bananas, nature's sugar bomb or misunderstood hero? I think I know. this.
I have already answered this question.
Yeah. Is rice the villain or just wrongly accused?
I think I answered this question as well.
Yeah, true. Okay. So millets, miracle grain or marketing hype?
No, I said the low GI index, high fiber, high macronutrients. So good to go. Very good to go.
Very good to go. Mango, carrot, beetroot. Are they really hazardous?
No, all good to go with moderation.
No, because why I'm asking this is because I've heard a lot of people saying कि diabetes है तो गाजर add ही मत करो.
नहीं,
diet
ऐसा
में.
नहीं है.
Beetroot add ही मत करो because there is a sweet potato add मत करो. I mean sweet potato is a power box.
ये जो सब चीजें हैं, as I said, they are high glycemic index, high glycemic load things. So I use them with caution.
Caution.
थोड़ा यूज कर सकते हो.
थोड़ा
आप
use
कुछ
कर
बना रहे हो, उसमें गाजर डाल दिया,
Hmm.
doesn't matter. Beetroot खा लिया, doesn't matter, because they have their own positives. They have got good iron. Beetroot has good
Because
iron.
they have other vitamins also.
Carrot has good amount of vitamin A.
Hmm.
So I mean, why say no for these things?
Yeah, so eat in moderation is what I
Yeah, yes.
roti count or roti quality? What
Both
matters?
moderation भी important है. Roti, I mean, jawar, bajra, that is also important.
Can I eat sweets if they are homemade?
I answered this.
Okay. Protein bar, is it diabetic friendly snack or hidden sugar bomb?
Hidden sugar bomb. If you read all those protein bars which are available in our market, I'm speaking about Indian market, if you see, there are added sugars there.
Okay. Wheat, bajra or jawar? Which is your preferred
Jawar and bajra.
jawar and bajra? Okay. What's the role of this hydration when it comes to diabetes and how important it is? We know hydration is very important.
Hydration is very important. It keeps your cellular function very good. It will, if you're well hydrated, it will excrete the sugars from the kidneys. It will keep your, if you're dehydrated, your vasopressin, your cortisol levels go up, and they cause, release of glucose from your muscles by gluconeogenesis. And again, I said in the past that the thirst is many times mimics as hunger. So drink ample amount of if you're feeling hungry and if you drink a glass of water, your hunger will just subside.
Achha.
So keep yourself hydrated for better cellular function and everything.
So this triangle, gut health, inflammation and glucose levels, resolve this for us. What's this connection between these?
Gut health plays very, very important role, because if your gut health is good, everything is good. Gut microbiota, जो हमारे पेट में naturally जो microorganisms present होते हैं, if they are altered, okay, so they will cause a leaky gut. ये leaky gut क्या होता है? Lipopolysaccharide release होता है, and that goes into the bloodstream and causes the chronic inflammatory process. This inflammatory process will cause chronic inflammation, leading to insulin resistance, leading to high sugars and obesity. So gut plays a vital role in maintaining good, state of your health.
So before we let you, go from here, what would be that one piece of advice that you would want to give to all people who are managing diabetes out there when it comes to their diet?
See, diabetes is not a disease, it's a disorder. So it's gonna live with you till you die. So don't think it as a,
End of the road.
end of the road, or don't think it as an enemy. So you have to manage your 30, 40 years of life with diabetes, with moderation, and with eating good, food, good exercise, and in between indulgences are totally fine. So I would recommend, don't consider it as like, मुझे ये क्या हो गया है, and then don't get depressed कि मुझे diabetes हो गया है. With a good lifestyle management, you can definitely live healthy, good life. I can definitely assure you that.
Thank you so much, ma'am. And just one last thing. Can you share some patient stories? Because you have been treating these patients from such a long time.
Mhm.
Some story which has really left a big, mark in your heart, or which is very close to your heart. Any patient stories with us?
No, there are multiple patients, who have been through. They come to you with the first time with the heart attack, and then, I have seen like one or two patients जो पहली बार आते हैं, जिनको हार्ट अटैक हुआ रहता है, उन्होंने कभी अपना शुगर भी नहीं देखा होता है, एंड
Oh
वी
my
कम टू
God.
नो दे आर न्यूली डिटेक्टेड डायबिटिक्स. Their
Ah,
sugars are on higher side. They come out of good angioplasties, and managing good lifestyle, and मतलब मौत के दरवाजे से आके they live good healthy life. I have know couple of patients who are running marathons now,
wow.
and I am like, I feel so overwhelmed looking at them ki at one point of time that person was dying. We saved his life, we made him understand the importance of lifestyle modifications, and now he's running marathon, and he is like a cheerleader to other people in the
And
society.
I also think this also you can also look at it in a way that he's paying a tribute to you for the favor that you have done on him by saving his life and actually taking
Yes.
the lifestyle modification seriously and
Yes.
moving forward. So that's that about diabetes and diet. It was lovely having a discussion with
Same
you,
here,
and
Tushita.
I'm very sure because these were some questions which are so frequently asked, and many people have many confusions around it. uh, Thank you so much once again for coming
Thank you so
on
much.
Sahyadri Health
Yeah.
Talks. It was lovely having you.
Yeah. Thank you so much. And it was great chatting with you.
Thank you. Thank you, ma'am.
Yeah.
That's that from Sahyadri Health Talks. Signing off, Dr. Tushita.